then like that's your best friend. Like, you my boss, yeah, but you don't give boss vibes. You give boss vibes, but you not like hi, hey girl, hey boy, hey. My name is T. If you're here, that means you follow me on TikTok or Instagram. If you don't already, definitely go follow me. So my name's T. I'm here to give you like my opinion on working as a travel hygienist in private practice, in DSOs, and all of that, okay? And ways to survive it, you know, especially as a new hygienist or assistant or front desk in the healthcare dental field, right? So first things first, make sure you hit that subscribe button, and you definitely subscribe to my channel. I will be more consistent now that I've moved. And I thank you so much for supporting me thus far. We got to 111 subscribers. Hey. And support my girl. I think her pronunciation of her name is Tajah ferjuste. If I'm saying it wrong, I'm sorry. Just stay. I'm sorry if I'm messing up her name. But I just got her scrubs. She has a scrub company called Tafe Scrubs. Anyway, I'm gonna put the link in this video if you want to check out her scrub company. They definitely fit the curvy girls. If you get the pink color, the blue color, I'm getting the pants exchanged as we speak, so I'll update y'all on that. But anyway, let's get to the video. So working in private practice, my first job, I already told you about. If you did not see that video, definitely check that out in my dental hygiene video. I'm gonna tag whatever video I'm talking about right here. I worked for private offices before. I've worked for dentists. I've worked for dentists that own their own practice. So I've worked for dentists who own their own practice. I've worked with companies who are corporate. So, you know, you just see them running ads and they pop up everywhere. They're a very big corporation company. And I've worked for like the regular mom and pop dentist, a dentist who doesn't want anything fancy. He just works for himself, and his wife and his daughter and his cousin and his nephew are the staff. I've worked for every different type of dental office. If you don't know, I've been a clinical hygienist for 7 years now, off and on, you know, but working in private practice is something you have to adjust to because it's not like school. School definitely gives you the space and opportunity to take 4 to 5 hours, several weeks to just treat patients, and you don't get that much time in private practice or corporate. You get like an hour with the patient, maybe 90 minutes if it's a new patient, but in that 90 minutes they expect you to do a lot, okay? So I'm gonna go through basically what a private practice or a clinical practice in the real world would be like, what the breakdown is, and then I'll give you my flow on how I work through the day so I can stay on time and get everything done and be organized and get everything done on time. You don't want to go through this part and you want to just skip to my experiences, I will put the time right here that you need to skip to. But other than that, this is the flow of a dental appointment. So you have 3 to 4 different types of dental procedures for a hygienist. You have a prophy, which is a healthy mouth cleaning. That is for someone who has 1 to 3 millimeters of pocket depth, who does not have bleeding, has very light to little calculus, plaque built up, very healthy. Their gums are very pink and healthy, and there's no bleeding, and they keep up with their hygiene. They floss, they brush, they rinse, they come in every 6 months. So their cleaning is going to be fairly easy, fairly quick as well. Definitely. And then you have what's called a perio maintenance, which happens after they've done a scaling and root planing or a specific dental procedure called a gum graft, which is a gingival graft. And basically they have periodontal involvement. They have gum disease and we have treated it, and now we're trying to maintain it. So their appointment is about every 3 to 4 months. we found that they are at a healthy point. So now they have to make sure they come in consistently to maintain. Their appointment may not be at 6 months. It may be at 6 months. That's really tailored up to the hygienist, the dentist, and the patient to see in, what they would need. That appointment could be anywhere from 45 minutes to an hour, depending on where you're working. Just like a prophy can be anywhere from 45 minutes to an hour. I would not suggest working at an office that gives you 30 minutes for prophy unless you have an assistant. And even then, when you have a hygiene assistant, it's very difficult to keep up with that type of schedule where you're side booked or you have several patients to see in a day, because it's just way too much for you. Next one is a scaling and root planing. A scaling and root planing is a procedure done when we find that your x-rays, your radiographs, your radiographs, which are x-rays, the pictures we take of your teeth, show that you have built up plaque beneath the gum line. We can see it on the x-ray. So if we can see it on the x-ray and in your mouth, that means that it's very heavy. There's profuse bleeding. When we measure with that small ruler called a probe to determine, the health point of your gums and your bone and see if you're periodontally involved, gum issues happening, 1 to 10 millimeters, you're at a 5, 6, 7, 8, 9, 10 plus. That's not good. We need to get you back to a healthier point. The scaling and root planing usually takes about 60 to 90 minutes per side or per appointment. I don't suggest doing 4 quads in one appointment. And then there is something called a limited scaling and root planing, which is the same procedure. It's just only going to be done on certain teeth. You also have a full debridement. A full debridement is done when someone who has very heavy plaque and calculus, or they have profuse inflammation and bleeding, and we need to get it treated, but they don't necessarily need a scaling and root planing. Or if they do need a scaling and root planing, this has to happen first just to get everything off the surface. This cleaning is done in lieu of a scaling and root planing. Usually this code in dental codes, like you would know, but this dental code would be 4355. So it's like right before scaling and root planing, but you might not need it, like depending on what the level of the patient's level is. So that's the full debridement. And then you have what's called inflammation with presence of gingivitis. So that code is 4346. That code is used when you're not so much a prophy, but you're not so much a healthy mouth cleaning either. And this procedure in this code was brought up by the ADA and the ADHA fairly recently, like in the last, maybe, I don't want to lie, but maybe like the last 5, 6, 7, 8 years, because when I was in hygiene school, they didn't have the code, I think, and I graduated in 2016. So basically that's what that is. It's like you right there in the middle. You don't have enough calculus to really consider you a scaling and root planing, but you're not a healthy mouth and your gums aren't pink and they're bleeding, or they just have a lot going on, as I was saying. So saying all of that, those are all the procedures that you would have to perform in the dental office as a hygienist, along with the x-rays, taking the charting for the patient, charting what's existing, like if they already have a crown, a cap, people call it, a root canal, if they already have fillings done, silver or white fillings, if they have veneers, you have to place them on the chart electronically, or baby, you might find a place that still has paper charts. So there's places who have paper charts and you have to put it down. There's some offices who are really strict about existing charting, and it makes sense because dental records are used as records when someone passes away. If they're, if they have a homicide or a murder, that's the first people they go to is the dentist to find out if the person can be identified, if for whatever reason. So we have to chart what's existing. So you have to chart existing, take x-rays, you have to do that periodontal probing, that perio chart, like I said, with the numbers, that you have to do that 1 to 3 millimeter thing. You also have to, most places now, you take intraoral photos. So those aren't x-rays, those are actually just taking pictures of the teeth and of the mouth and everything. Some places, which they should be doing every visit, but some places do an oral cancer screening. So they either massage around the lymph nodes of the neck and everything, and around the head and neck area. And they also look in your mouth, and they may also use a device that shines a light into your mouth and looks around your mouth and does the oral cancer screening without the naked eye as well. So all I'm saying to say, I can't name every procedure, but my point is that you are going to have several procedures that you're doing in one setting, and it really depends on the appointment. You're going to put on fluoride, you're going to irrigate a gingival pocket, if it's a child, you're going to place sealants, or if it's an adult and they're high prone and high risk of cavities, you're going to place sealants most of the time. You're going to have time to inject the patient if you're local anesthesia certified, like numb the patient. So that's why each procedure and each appointment has a different time. So my point is, it's going to be anywhere from, unfortunately, I don't want to put it in the air, but unfortunately you might expect to see a patient from 30 minutes. I would not do that unless I have an assistant, to 90 minutes. Some places, they make it however they want. It could be 120 minutes. It really just depends on the procedure, what the patient is doing that day, and also if the patient is compliant as well. Like, if the patient can be done in 30 minutes and you've seen them several times, you as a hygienist can come and be like, the appointment can be shorter. That's really up to you. And that's what I love about this profession. It's very flexible. Depending on the office you work at, your manager and your dentist that you work with, and your other hygienists you work with, your staff, your assistants, you can decide how your schedule can go, really, or you can, be flexible with it. So my experience working in private practice, it has been bittersweet. I feel like any career is very bittersweet. I feel like I've met dentists who are very kind, very nice, who are very dedicated to what they do. They went to school for this. They want to do it for the rest of their life. And then I've met the few who it has nothing to do with them being a dentist. It's just their personality, who are very arrogant. They feel like because they have DDS or DMD behind their name and they went to school for 10 years or 6 years longer than me, that they could talk to me however they want, or they feel like they're smarter than me because they make more money than I do. And then I have some dentists who are just very humble and down to earth and chill, and I've had to find my environments that I work well in, and I've had to transition myself out of certain environments that I feel like did not work for me. So if you don't know, I already do travel hygiene right now. So I'm still licensed in the state of Florida and New York, and I just travel around providing hygiene for patients in several dental offices. And I'd rather that than have a job, because private practice really drove me out to work a 9 to 5. And so did the DSOs. The DSO is a dental, I'm going to put the actual term here, but it's a dental service organization. I'm going to put the name here. I'm going to say dental service organization. I don't know. But basically like a company like Aspen or Smile Design, or an office like, what's the other one I be going to? Heartland Dentistry. If you've been looking at jobs or you work for any of these companies, you know what I'm talking about. Those are considered DSOs. They basically pop up so often because they open up an office somewhere, and they are just like corporate. Like, a DSO could also be a dentist or some business person, because they don't always have to be a dentist, that decides to open an office, and they open another one and another one and another one and another one, and now they have 5 offices, and all 5 offices are all over, or they have 5 offices in this specific city. That can be a DSO too. So I'm mistaken. A DSO is basically a small dental group that has broadened their horizon by owning different offices. And then a corporation is more like a really large company like Aspen or Coast or Heartland. But Heartland is still kind of considered a DSO, even though they're that big, because they purchase old private practices and they flip them and turn them into their practice, and they change the whole procedure, and They sometimes don't take the same insurance, so they change the patients. Like they come in and they physically change the whole office. Like, you know, I feel like I work better in a DSO situation because the manager is the person who facilitates like all the important managerial duties, and the front desk just handles like insurance and making scheduled appointments and handling everything with that. And then the dentist does the dentist stuff. They do their procedures and they do whatever they need to do, and the hygienist does whatever she or he needs to do. You don't have to think about like, oh, the dentist is my manager. The dentist isn't my boss in DSO. You know, the dentist can ask me to do something, but I don't want to say you don't have to do it, but it's more like, I'm trying to choose my words carefully. Like, you can still debate it a little bit because the office isn't owned by the dentist. If the dentist decides to tell you something and you don't agree with it, you still have a little say because you're an employee of the company, of the DSO, and you can transfer, you can do whatever you want to do with it. You can make the schedule to a certain degree to your liking, you know, versus when you work for a private practice, the private practice dentist, he owns the practice, he's the boss. The name on the check that's being written to you is his office. That office pays for his kids to go to private school, and or for her to buy her Louboutins and her red bottoms. So she has a certain kind of way that she interacts with you because she's your boss. And also with private practice, they don't really give you benefits like that. And if they do give you benefits, then your pay is going to be lower hourly. Or if they give you benefits and they give you good pay, then they expect a lot from you and you have to live up to that. And there's nothing wrong with that. It's just not for me personally. So yeah. So my experience in private practice, I always felt like, because I have a very dominant, independent personality, and I'm a very strong-minded person, so I just can't let nobody play me mentally. And I feel like some of these dentists that I've met in private practice that own the practice, not just they feel like they could just tell me what to do because they write my checks. I'm on their payroll, so they could just do whatever they want. And sometimes that's even to a point where it's not ethical to the patient. They're not holding up to their autonomy for what they vowed to do for the community, you know. And sometimes I just run into things where I just did not like. I didn't like not only just their personality, I didn't like the way they was running their office. They felt like, because, you know, like for example, I could be busy dealing with a patient. My appointment is almost over. I had a healthy patient, a prophy, so I'm done now. I have about 20 minutes to spare. I stocked my room, everything is clean, my notes is done, I already did my chart prep and looked over my schedule for tomorrow. He's gonna come in the room, if he's that type of personality, and he's gonna be like, or have the manager come in the room and be like, see what she's doing, like see if she needs to like restock or something. And it's like, why are you worried about what I'm doing? Because you on his clock. You on his clock, so he feels like he could tell you to do whatever he needs you to do. Versus me in the break room eating my muffin or my little yogurt or whatever. I can't do that because I'm on his clock. It's like, sometimes, not every single dentist is like this that you work for in private practice, but they feel like because they pay you and because they're the boss and because they see physically where every single dollar and cent is going for the business, they could tell you what to do. And it pisses me off. Like, it gets under my skin to a point that I just be like, I had this. Y'all can have this. Like, I don't even want it. Like, nah. But I'm not trying to discourage y'all from wanting to do private practice. You might find a dentist who is so chill. He or she might just be like, y'all locked in. Like, that's your best friend. Like, you my boss, yeah, but you don't give boss vibes. You give boss vibes, but you're not like, you know, like. So you might get that, and I hope that, and I wish that for you. But there's a time when you just might not, like, and you might get that asshole dentist, and you're gonna have to really decide what you're gonna do. Like,